but being able to say no is a huge, huge skill. I tell my residents about this all the time. Don't just say yes because you feel like that's the expectation.
Hi, I'm Jeff Kozlowski, and today on The Next Step, I'm joined by Dr. Bo Hoon Lee, a child neurologist here at the University of Rochester Medical Center. Dr. Lee subspecializes in pediatric neurogenetics and pediatric neuromuscular medicine. She completed her medical school training here at the University of Rochester in 2013 and now serves as Associate Program Director for the Child Neurology Residency. In addition to her clinical work, she also spends a significant portion of her time in research with a focus on clinical trials and investigator-initiated studies. In this conversation, we talk about how she shaped a career that blends patient care, research, and teaching, and how being intentional, flexible, and well-mentored along the way helped build a role that truly fits. Dr. Bo Hoon Lee, thank you so much for joining The Next Step. How are you?
I'm well, thank you for asking, and I'm happy to be here.
Yeah, I'm excited to have our conversation today. Lots of topics to cover, but first, can you just give a kind of a quick intro of who you are and what you do here at University of Rochester?
Yeah, sure. So I am a child neurologist, and that is a pediatric specialty, but within it, I sub-specialize in two subspecialties. I do pediatric neurogenetics and pediatric neuromuscular medicine. And so that's my clinical sort of role. I also am the associate program director for our child neurology residency. And I spend about 50% of my time doing various research about a mix of clinical trials and kind of my own sort of investigator-initiated stuff.
So let's go back to, I get not too far back when you were into medical school. So, you're probably entering medical school at 21, 22 years old. Back then you were certain you wanted to be a child neurologist already. You knew. So where did that clarity come from? How did that kind of shape your early decisions?
Yeah, I was pretty certain. Maybe I'm just like a rigid person, but like I think one of the things that really influenced that was that one of my first clinical exposures was to a child neurologist, and she happened to be an amazing one. And so when I was in my undergrad years, I did some research and with Anne Connolly. She was at WashU at the time, and she was doing research in mice with Duchenne muscular dystrophy. And that was really cool. But then she kind of invited me to come to clinic with her. And I just fell in love with that sort of what she was doing there. I saw her interact with her patients, her families, and it was really my first encounter other than like having had experiences with my own pediatrician. I don't have doctors in my family, but it was my first encounter in that setting. And I remember just thinking, wow, like I definitely want to be someone like her. And so I came in with the idea that I would really like to explore child neurology. And I had that thought of like, maybe she was special, like she was just, she doesn't, represent all child neurologists. But I found that even though there were obviously some differences, the child neurology group here, every one of them, I just felt like, yes, in many ways, I would love to incorporate your essence into the kind of person I want to be, the kind of physician I want to be. And so I never really faltered away from that.
And Rochester wasn't originally on your radar, right?
It wasn't, and it was mostly for like geographic reasons. I grew up in Brooklyn, and even though I did go to undergrad in St. Louis, I had sort of the intention to return, quote unquote, home to the New York City area. That's where my parents were, my brother, a lot of friends there still. And so it wasn't on my radar geographically, but it was within New York City, or New York. So when I applied to medical schools, I applied a little bit more broadly than just the city, and it really surprised me. I was actually going back and looking through sort of old communications around that time, and I was very, very impressed. And Rochester like shot up to my first choice for medical school.
That's awesome. And I know when we first spoke about this and kind of, preparation for this, you mentioned being quieter, a little more reserved earlier on in your career. Um, did that influence the kind of environment, you wanted to be in?
Yeah. I think one of the things I actually felt when I interviewed here, it was really a nightmare for me because my flight got canceled.
Oh,
And
horrible.
that kind of thing, for just like culturally for me and just my personality, it was like, oh my gosh, I'm creating now this like cascade of people needing to reschedule my interviews and everything. There was a med student host who was supposed to pick me up at like 11:30 p.m. from my original flight. I had to cancel that. It just was like I was like, there's just no way. This is too much trouble.
I'm done.
But everyone here was so gracious about it, and it ended up probably working to my favor because when things got rescheduled, I ended up getting more time with my
Okay.
interviewers. And like it just felt, even though I didn't know these people, they didn't know me, it felt very homey. And being the kind of person who is quieter, more reserved, maybe quote unquote introverted. I felt very comfortable and I was like, wow, I felt like I could thrive here.
And the original plan was to train here and then maybe go elsewhere. Was that right? And something kept pulling you back, and obviously, it's been quite some time now. You were convinced to stay. How did that happen?
Yeah. Yeah, I think it just again having grown up in New York City,
Yeah.
and having most of my family there. It's not far, but I had always planned to consider moving back to the city, growing up, or raising my own children where I grew up, type of thing. Um, and you'll hear this a lot from Rochesterians, I think. And I now tell people that I'm from Rochester. I don't know at
Ah.
what point you're allowed to transition to that phrasing, but I feel like I've been here for almost 20 years now. So I've decided, hey, I get to call myself that. Um, but there's this like, I don't know, people say Rochester draws you in. I know a lot of my medical school classmates, if they did go away for residency, they actually came back here ultimately afterwards, to be faculty. So there's something intangible maybe about Rochester that kind of keeps drawing people back here. I also met my husband in medical school here, and that naturally kind of set us to live here and start a family and all of that, which has been great.
Is there something about kind of a smaller, I don't know, mid-sized city like Rochester versus a big city? Obviously I'm sure there are plenty of advantages to looking to work in a place like New York or Boston, the big cities, and that's great. But is there something that, since you've been here for a while now, that you can point to, like the size of Rochester, or anything like that, that says, yeah, this, maybe this is a good reason to stick around in a city like this size?
Yeah, I mean, we're not super small of a city, and
No.
I feel like we have everything we need. It is such a good city for young families, which is what I am now. I have three young children, and we have great school districts. We have, I mean, the restaurant scene, like the social scene, that kind of thing has really grown over the last, 10, 20 years. And we're just close enough to Toronto,
Yeah.
and the big cities that I much prefer to visit those cities, than to live there where your commutes are just naturally longer. I love that my drive to work is like 8 minutes.
Yeah, I come from the Washington, D.C., Baltimore area. And I mean, just the sheer amount of people and the traffic difference is enough for me to be like, I love it here.
Yeah, I mean, I commuted to high school and it took me by subway about just under 2 hours.
Oh my
Um,
gosh.
and I don't think it's a coincidence that we now live across from our high school,
It
where my
scars you.
children, when they get there, will be able to like walk there in 5 minutes.
You don't want to put that commute on anybody.
No.
Um, okay, so you mentioned this at the beginning in the intro. You kind of have this 50-25-25 split from between clinical care, your research, and teaching. That's not necessarily, I don't know if norm is the right word, but you had to do some things to actually make that happen because you saw your interests were in a few different places. How did you make that happen for yourself over time?
Yeah, I think it's there are certainly other people who have similar
Sure.
splits. I think it's just maybe less traditional than the sort of 80-20, 20-80 clinical and research split. For me, I started out actually predominantly clinical, and over a few years, I started um, incorporating a few projects here and there, and it turned out I actually liked all three aspects. And so trying to get that to be a doable, feasible split sometimes can be tricky. I do feel like the biggest thing that allowed me is just having that sort of flexibility. In my own thinking, like, it's okay to do a little bit more in certain times and less in other times, and kind of shift priorities and time commitments. And as long as you're not kind of like rigid and saying like, well, I will only commit, I will have to have 80% of my time protected for this.
Hmm.
I think that is, for me at least, what has worked.
And I know, again, when we met the first time, you talked about an exercise where you wrote down everything you were doing, and sort of looked at what did and did not align with your values. What did that reveal, and how did that kind of help you in, kind of making this role for yourself?
Um, yeah, I think it's easy when you're relatively um, new to becoming faculty. You don't have like a huge patient, base yet, and
Hmm.
sometimes it's easy to be like, oh, I have all this time, and people start asking you to do things, and I have always been a bit of like a yes woman. I say yes to a lot to most things, to a lot of things, and that's partly because I like doing a lot of things, but one during like a junior faculty like um, mentoring program that I did, one of the things they asked you to do is like, we know that you know sort of what you're doing, but try writing it out. Like, what are you doing this week and last week? Like, what did you spend your time doing?
Hmm.
And I was like, oh, well, do we really have to do this type of thing? But when you do it, you're like, oh my God, look at all of these things. And there are some things that just weren't going to serve me from a like long-term career perspective. But I might have been spending time doing just to kind of um, to meet that expectation because someone asked me, and so it was a little bit uncomfortable at times, but being able to say no is a
Hmm.
huge skill. I tell my residents about this all the time. um, don't just say yes because you feel like that's the expectation. um, and there probably are some times where you do have to do that, but um, I also think that being kind of careful about where you commit your time makes it so that you're spending more time doing the things that you enjoy, and you tend to be more productive when you're doing the things that you like to do.
That exercise that you talked about, it's so funny because your initial reaction was, oh God, like that sounds like a lot. And you see like productivity experts and all, like if talking about time management and whatnot, the one thing they always say is like, well, track what you do for a whole week or something like that. Write down everything you do. And just the thought of that, I'm like, I'm not going to do that.
Yeah, it
But it
sounds
sounds like it's
so
worth it.
like, is that really gonna help?
But it does.
Yeah. That
Yeah.
yeah, I do think that that was helpful for me in turn, like just like looking at it rather than thinking about it, there's something to that.
Hmm. And so for, if there's a trainee student listening to this that, thinks, okay, that, I have a lot of interest too. I don't know about that 80/20 rule for me. What is a good first, maybe realistic step they can take?
Um, I think what I maybe didn't do earlier on was really understand what that meant.
Mm,
I think that research can mean a lot of things. I never asked the questions, probably partly because I was embarrassed to ask. I was like, is this something that
mm.
everyone just knows? And so I would encourage residents and even medical students to ask those questions about what kinds of research are there and how do they fall in terms of like once you become a faculty member in an academic institution, like how are they counted? Um, and 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 then once you kind of have a better understanding of that, I think finding people who might be doing those types of research and getting a sense of like what that looks like.
And through the process that you mentioned of figuring out what aligned with your values, and through some experience, you realized that teaching was something you really enjoyed. Um, how did that kind of, once you realized you liked that aspect and you know, working with residents, how did that change the way you shaped your role?
Um, yeah, in some ways, I feel like a lot of like how I ended up to where I am now, there's a lot of serendipity played a lot of
Mm,
roles. Sometimes you might want to be, a residency program director or something, but there's already somebody in that position
yeah.
and so sometimes I think that for me, it's just I've been very lucky in that sense, in many ways, not just with my APD role, but in research and even in clinic, and my sort of relatively non-traditional training. Um, there was some component of that with residency and teaching. I think I sort of um, was asked to do these things that I said yes to initially.
Hmm.
And again, I said, don't say yes to everything. But, sometimes you don't know whether you like something or not until you do it. And as I was doing it, and when I made that list of things I was spending my time doing, I could not get myself to cross off any resident teaching related activity. I knew that I wanted to continue doing that. And so that signaled to me that that was important. That was something if I could, I wanted to formalize. And then I was lucky enough that there was, our residency was expanding, and an additional APD was needed. And so when I was asked, I of course said yes.
I love that. Coming back to being the yes. Um, talk now about clinical trials. Um, how did you get into doing clinical trials?
Yeah, it was a bit of a sort of like there wasn't sort of like I was not doing clinical trials one day and then I was doing it the
Yeah.
other day type of thing. Um, it's very hard as a resident to be involved in clinical trials, just because of the way clinical trials are done and funded and the timing of things. Residents are on
Mm,
rotation basis and clinical trials run over time and the visits happen when they happen type of thing. Um, And I think what, for me, my initial sort of experience was that I was in clinics in the pediatric neuromuscular space where we were talking a lot about clinical trials because patients were interested in clinical trials that were either being done or wanting to enroll in clinical trials. And so I was like, hey, maybe, like, in this clinical scenario, it seems like you really need to be up to date on the landscape. And so while I was reading up on the different clinical trials, I also happened to be at a time where we were having some Duchenne clinical trials and I was offered the opportunity to kind of be like a sub-I, and learn in that way. And I think what I did not realize, like, I don't know that until you do it, you really know all the different components, right? When you think about the clinical trials and what you learn from the media is like, okay, patients get a medicine or don't get a medicine, and then they either do well or they don't, type
Right.
of thing. But there's so much more to setting yourself up to a clinical trial that I don't know that I would have learned even from like a didactic. Things like budget setting, the agreements that happen, the regulatory stuff, all of those things. And so, sorry for that very long-winded answer, but it
No.
just kind of, I was able to squeeze in to get that experience. And then once I did, I was like, I really like this. There's a lot of learning to be had. And I still am. I'm no clinical trials expert, but I'm definitely kind of working towards that.
And I think having a good mentor played a key part in your clinical trials experience. And I know you still work closely with Emma Sheffaloni, another child neurologist here at the medical center. How did you get to start working with Dr. Sheffaloni?
I really liked the patients she was seeing. Nobody actually, before I joined our pediatric neuromuscular group, nobody else was seeing pediatric neuromuscular patients. So those are the kids with spinal muscular atrophy and Duchenne muscular dystrophy. And I was actually doing training in neurogenetics at the time,
Mm,
but I was really interested in neurogenetic therapies. And the time, again, serendipity, the time aligned that while I was in my like sort of last year of training, therapies for the neuromuscular genetic disorders like SMA and Duchenne was just like exploding. And
mm,
so any chance I got, I would want to see those patients. And so I would go to her clinic. And and many of us are people who, like, when somebody, like, if you love what you do, if somebody who's junior to you, a med student, a resident, shows interest in what you're doing and wants to potentially do what you're doing, I think that's really exciting.
mm.
um, and so I think Emma caught wind of that, or felt that. I don't know how she couldn't because I was always there. Um, and I think that really kind of grew into a very strong mentor-mentee relationship.
Yeah, you kind of hinted at not necessarily stalking Emma, but intentionally inserting yourself
Yeah.
into the work you wanted to be part of. How do you do that respectively and effectively? I think part of it too is probably, like you said, if someone more senior sees someone younger interested in something, it's just exciting in general. But if somebody wants to kind of insert themselves into another area or work they want to be part of, how do you go about that?
Yeah, you don't want to, I think the important thing is, again, showing that motivation and interest, but also being reliable. So, I wasn't just like letting her know, like, I'm going to be here and then not showing up, or, I really, and I was doing my own work on the back end, right? I didn't completely rely on her to give me all the information and teach me everything about SMA and Duchenne. Some of that, like, sat on me, and I would read. And that's how I also knew I was interested, as I was spending my time reading on SMA and Duchenne and the therapies, because I found that so exciting. And I think that, again, naturally that just evolved into a good relationship. And I wanted, when I when she kind of gave me some early ideas for little manuscripts or projects, I followed through on those things, and I think that helps too.
And anything else you can speak to toward why your relationship sort of still works so well today?
I think that one of the biggest things is that um, I, I guess I was lucky in that she is the kind of person who measures her own success by the success of her mentees. And that is such like a special quality to have in a mentor. Because I think there are lots of successful people in different areas of medicine, in research, etc. And not all people will, and many of those people like mentor younger faculty. But she has this really like great ability to know and share. Like she's just a very she's very good at sponsoring her mentees. So if she's asked to do something that would be good for a junior faculty's sort of career trajectory, she would very easily hand that off and recommend that person to do that instead. And I think that is, I think that a lot of people have that quality, but that is one of those things that you really want to try to find in a mentor. And of my mentors, she's not the only one who does this. And sometimes mentors will show you their like, when I did my neurogenetics fellowship, I was the first person. There was none before me, and so I relied very heavily on the neurogeneticists who were here. There were two of them to agree and want to be part of that training program. And I think they could have easily been like, sure, and then and not followed through on all of that. But I had really, really strong mentorship through my neurogenetics fellowship training. And this was added hours onto what they were already doing. And so I'm really just very grateful for all of my mentors. I often speak a lot about Emma, but I have many other mentors. I think, U of R is just full of really strong mentors.
And now, kind of moving back to your work in teaching now, what questions do residents most often bring to you now if they're stuck or unsure about something?
Well, one of the first kind of stuck conversations I have is that in child neurology, our residents often subspecialize. And so at some point during their residency, they have to sort of choose if they're going to do a fellowship or if they're going to go straight out into outpatient practice. And so I think I have had some mentorship conversations around that, like should I do fellowship or not, or what kind of I like this area and I like this area too, and so kind of walking through that piece. I've had now a couple of people who are graduating and then looking for their first academic, faculty position and mentorship around like what should that look like? What are the pitfalls and things that I should be careful about when negotiating or kind of navigating that space. It's been fun to be on that side of it.
Yeah. If you run into someone who sort of likes a lot of things, how do you help them narrow?
Yeah. I I think one of the things I was told very early on, actually, in medical school, was that in some ways you have to look at things like practically too, in addition to like what just like fills your cup in terms of like the content and what you want to learn about. But practically, every subspecialty, every field has sort of like a bread and butter. And you want to be in a position where you are happy doing what you are doing. Like, I really feel that that is like core to to success is that you
Mm-hmm.
enjoy what you're doing. For people who aren't sure, I think they just need to spend more time dedicated to figuring out whether that is that fulfills them in that way. And so sometimes it just means like, hey, maybe we need to shift electives or relook at another experience here or elsewhere in that subspecialty. Did I even answer that question? I think I've been going on a few
Yeah.
tangents here.
No, I was about to ask like how your definition of success has changed, now mentoring others and since residency, but I don't know, that might go right along with that, right? If you're happy and fulfilled doing what you're doing, is there anything to add there?
No, probably not. I think, like, again, at least for me, I'm most productive when if I'm writing a manuscript about something that I have a lot of interest in, right? I think that's just natural, right?
Yeah.
Um, and we live in a world where unfortunately there is a lot of physician burnout. And I think you can lessen that by doing what you want. I guess that's kind of where that comes from.
Yeah. Any particular piece of advice you got early in your career that maybe you were glad you ignored?
I think as somebody who likes a lot of things, there was some caution against spreading myself too thin. And part of that was, again, looking at that list of things I was doing and narrowing that down. But even so, I mean, feel like as somebody who, from at home, I have 3 young kids. My husband is also a medical professional. He's a surgeon. So we're both very busy professional people. We are involved in our children's lives. I go to school events and things like that. At this point, I'm not the kind of person who ever has been a very prideful person, but I do feel like I'm in a really good place and position. And I think that I look back to me 10 years ago who probably thought like, well, you got to choose one of these things. You got to
Mm.
choose either to do predominantly research or predominantly teaching or predominantly being a clinician. And I didn't really choose one of those things. I am splitting across all of those things, but in a way that I feel like I'm doing it in a productive way. And so I would say that that's one thing that I'm glad I didn't put myself into that box of only limiting myself to sort of pursuing one of these big categories of, career paths. Does that make
Mm-hmm.
sense?
Yeah. And if there's a trainee listening who wants to be intentional about their career and path that they take, what mindset should they start cultivating now?
I would say one, find your mentors and have more than one.
Mm.
Mentors can serve different purposes. So, you certainly can have a mentor in the field that you want to go into, but most of my other mentors are not within uh, neuromuscle. And so find your mentors, find good mentors, and then have multiple mentors. And I would also say, again, just take a look at what you find yourself wanting to spend time learning about, reading about, where you find happiness, because that really, I think that leads to like sort of longevity in a happy and fulfilled academic career.
All right. Well, Bo, that's all the questions I had. Thank you so much for all of your time. Really appreciate it.
Yes, thank you.
Thanks so much for tuning in to the latest episode of the Next Step podcast. If you liked what you heard, please share with other members of the University of Rochester community or anyone you think could benefit from these career stories. And we wish you nothing but the best in your own career journey. Until next time.